So we're going to be doing manual ventilation of the patient with an oral airway placed. So I went ahead and came into the room, knocked, entered the doorway, and introduced myself and my department and explained what was going to be happening. I also assessed the patient at that time, and then we decided that the manual ventilation was necessary. And so the first thing that I'm going to do is wash my hands here, and then I'm going to glove up, and then we're going to go ahead and manually ventilate this patient. Okay, so I already went ahead and gloved up, and I assessed my patient for their pulse, for their SpO2. I assessed them for their breath sounds, and so they need to be manually ventilated. And so first thing that I'm going to do is place the oral airway. It looks like this. Then you're going to measure the oral airway to make sure you have the correct size, and we do. So to insert the oral airway, we're going to go ahead and stick this in toward the soft palate and rotate it 180 degrees. And we're going to make sure that the tongue does not occlude the airway when we do that. So go ahead and place it. We're going to place the patient in the chin tilt. So we're going to just go ahead and, there we go, to open up that airway. And then we're going to go ahead and insert the oral airway. And then the flange will sit right on the lips. Continuing to assess the patient, we're going to go ahead and hook up the ambu bag to the oxygen so that it will fill the reservoir. And then we're going to go ahead and place the mask onto the patient, creating a tight seal. And so what we're going to do is we're going to manually ventilate the patient with 12 to 20 breaths per minute. And we're also going to correlate our breaths with their spontaneous breathing if they have any. Throughout this time, we're going to be looking for chest expansion, which if you look right here, you can kind of see chest expansion when I ventilate the patient. Throughout this manual ventilation, we're going to be checking the patient for their pulse, for their SpO2. We're also going to be listening to any breath sounds as well, and continuing to assess the patient while we manually ventilate them.